Hello everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. So we are started with the lower limb session. Our today's topic is adductor canal. This topic we will be studying with the 3-4 subtopics including introduction, extent, shape boundaries as well as content. So adductor canal, also known as Subsartorial Canal or the Hunter's Canal. Let's begin with the introduction. The adductor canal is an intermuscular space which is situated on the medial side of the middle 1/3 of the thigh. So in this diagram we can say this is adductor canal. It is situated on the medial side, on the middle 1/3 of the thigh. It has extent. Above it is bounded by apex of the femoral triangle. As we can see below, it ends in the tendinous opening in the adductor magnus. It is triangular on the cross section. Boundaries: it has 3 walls: anterior lateral, posterior medial and medial wall. And posterior medial is also called as floor and medial wall is also called as roof. Anterior lateral wall, it is bounded by vastus medialis. Posterior medial wall is formed above by the adductor longus and below by the adductor magnus. Medial wall, that is roof, which is a fibrous membrane joining both the walls overlaid by the sartorius massive. Subsartorial plexus of nerves lies on the fibrous roof of the canal under the cover of the sartorius massive. As we can see in the diagram, this is the subsartorial plexus. Its content: it contains femoral artery, femoral vein, saphenous nerve, nerve to vastus medialis, and 2 branches of divisions of obturator nerve. So femoral artery, it enters the canal at the apex and gives off muscular branches and the descending genicular branch in the canal. Femoral artery enters the apex and gives off muscular branches and the descending genicular branch in the canal. Femoral vein, which is posterior to the artery in the upper part of the canal and lateral to the artery in the lower part of the canal. Saphenous nerve, which crosses anteriorly from lateral to medial side to the artery. Nerve to vastus medialis, which enters the vastus medialis in the upper part of the canal. Then we have branches of 2 divisions of the obturator nerve. So these were the contents, which includes femoral artery, femoral vein, saphenous nerve, nerve to vastus medialis and branches of 2 divisions of obturator nerve. So this is the diagram of the content of the obturator canal and this is the location and the extent of the obturator canal. So the diagram we can see, it is very easy to remember as we can resemble it with the diagram of butterfly. You can imagine this is the mouth of the butterfly and these are the 2 wings of the butterfly. So it will be easy to remember like this. It contains femoral artery, femoral vein, branches of anterior and posterior division of obturator nerve, nerve to vastus medialis and saphenous nerve. I hope you understood my topic. If you want more videos like this, you can subscribe to my channel and follow it. Thank you so much. If you have any queries, please do comment in the comment section.